Dr. James Smith. I practice family medicine as well as palliative medicine and hospice.
Thank you very much. First of all, I'd like to ask for the people, what is tuberculosis?
Tuberculosis is an infectious bacterial disease. Most commonly affects the lungs, causing kind of caseated granulomas, which are just kind of pockets of infection in the lungs, often associated historically with coughing up blood, decreased lung function, people kind of wasting away. Use a lot of old terms for it. You always see it in like the Western films of anyone dying of consumption. That's tuberculosis.
Okay, thank you. Now, in your experience as a family medicine clinician, what challenges have you faced with treating the disease or diagnosing the disease?
Yeah, tuberculosis is it's a difficult disease. We usually check for it with screening with the PPD, which is just a skin test. Unfortunately, that test isn't helpful in anyone who grew up in another country where they get vaccinated against tuberculosis. Or if they ever tested positive, then we have to look at things like a chest x-ray, but depending on how severe the disease is, we may not really see anything. Really, the best way to check for it is we have to get what are called sputum samples, which are kind of collections of the mucus from down in the lungs. But they have to be able to get that up, and then goes to the lab and has to get tested. Treatment's also very difficult because it's prolonged. Even if you just have what we call latent tuberculosis, which is you test positive but you're not having symptoms, it's still multiple months of daily treatment. And if you have active, it's closer to a year, and so we lose a lot of patients to follow up.
Okay. How does TB continue to be the problem in the world, especially third world countries, and why?
It's a problem because it's contagious and it's airborne. More than these kind of masks don't work for it. You need kind of the same kind of mask. The N95s, the K95s that we found were the only ones that really helped a lot during when COVID was more widespread, and we didn't have some of the interventions we have now. It's also a disease of, but it's all. Although that said, it's also very bad at transmitting itself. So it often requires close proximity to someone who has active disease, often for multiple hours. So unfortunately, in a lot of third world countries, the housing conditions, there might be a lot of people in the same household, sometimes 8, 10 people living in a one-room house, where they're all close in proximity and it can spread easier, and they don't have access necessarily to the healthcare system that they would need. And I said it's a prolonged treatment, often 6 to 9 months, and you have to be able to afford that medication and be able to get access to it.
Thank you. Well, for that reason, what resources do you think physicians in third world countries should have better access to in order to help fight the disease? Maybe some current measures in the U.S. Maybe, I suppose.
Yeah, so the biggest is just the socio-economic situation, making sure that there's adequate housing, that housing for the number of people, that's well ventilated, and making sure that there's early detection and early access. Once it gets into a household, if they're spending months sleeping there, it will spread to the other members. So making sure that people have access to that, and then access to the treatment that they can both afford.
Yeah.
Or hopefully be given to them. But the other problem is you also have to have the checks that they're taking it. A lot of times we trust the patients to take the medication so they don't spread it. But that's not always the case, and eventually, occasionally, we do have people in the hospital for months and months because they can't be relied on to take it, and they are considered a public health risk.
Okay. Well, what do you wish the American public or the public knew about the disease?
It's treatable, but it's annoying. You don't want to have it treated. Biggest things are just know if you're going to travel abroad. It's very unlikely to have it caught in the United States. But if you're traveling abroad, especially Eastern Europe, kind of Southeast Asia, be aware. Try and avoid prolonged bus trips, or stay in kind of quality accommodations. I said it's not great at spreading. If you're really concerned, wear the masks, of course. But really, if it looks dirty and dangerous, it may be.
hopeful that TB will be more preventative in the future?
Yeah, I mean, so because it's bad at spreading, the better we can get it controlled, the less cases there are. It's going to take harder to, it's going to take longer, it's going to be harder for it to come back. So the main catch is how long it takes to treat and losing those patients to follow up. So I think, if we can improve the world's living conditions, which would be a nice goal overall, we should see less tuberculosis as well, make it kind of more sustainable for everyone to have healthy, safe housing and lives.
Okay, I think we're good. That was good.